to Ms. Lewis for 5 minutes.
Good morning, and thank you to the committee for inviting me to speak with you today. My name is Nicola Lewis, and I'm the Chief Executive Officer of Kids Brain Health Network. Kids Brain Health is a Canadian national network that puts science to work for children with neurodisabilities and their families. These are lifelong conditions characterised by impairments in cognition, communication, behaviour and motor skills resulting from abnormal brain development. We support the development of cutting-edge research and the implementation, scale and spread of evidence-based solutions. With funding from the federal government's Networks of Centres of Excellence programme and equally matched funding from many other partners, we have invested more than $77 million into over 200 projects and research initiatives so kids with disabilities and their families can live their best lives. Kids Brain Health's focus is directed upon proven solutions in early identification, early interventions and effective treatments, and family support. Today, I will speak to you about one of our programs, the Family Engagement in Research program, better known as the FER program. FER recognises parents and caregivers as equal partners in all phases of the research process, from research question design to data collection and analysis, and disseminating the findings into practice. FER is funded by Kids Brain Health and co-led by parent leaders and paediatric health service researchers at CanChild Centre for Child Disability Research at McMaster University. I would like to introduce in the audience Dr. Andrea Cross, Assistant Professor from CanChild, and Ms. Connie Putterman, a parent partner who are two of the co-developers and co-leaders of the FER programme. The FER programme includes an evolving suite of training courses, knowledge mobilisation and mentorship initiatives. It is led by citizen partners and researchers and is rooted in the shared values of co-creation, collaboration and respect for the different types of knowledge and experiences. The inaugural FER course is a fully accredited 10-week online course for both researchers, trainees and family partners. To date, 300 graduates from 14 different countries have taken the course. Half of those are parents and caregivers. And many have advanced to become leaders across institutions and networks in neurodevelopmental disability, child health, mental health and women's health research. We are currently in the process of adapting the course for youth and self-advocates with lived disability experience, frontline practitioners and healthcare providers. We're also expanding the course to ensure availability to Francophone researchers and families. So far, 3 Francophone course instructors have been trained and a French FER course will be launched this year. More recently, we launched an advanced 10-week online training course for FER graduates called the FER Leadership Academy, with the aim of being a springboard for future FER leadership development in Canada. The FER programme has become a nationally and internationally recognised forum for training and mentorship. The programme is creating a rising movement to embed best practices of citizen science into neurodevelopment and child health research, institutions and networks across Canada and abroad. But while the programme has grown through several partnerships, further investments are needed to sustain commercialisation nationally and internationally. Over the years, we have seen the positive contributions that equitable and inclusive training has on the research for kids with neurodevelopmental disabilities and their families. Kids Brain Health is proud to fund programmes like FER that allow families and caregivers with real-life experiences to provide researchers with context they would otherwise not have, and therefore producing outcomes that are much more easier to implement and more likely to provide value for families. Canada has an opportunity to be a global thought leader in citizen engagement in the conduct of health research and implementation to the betterment of our children and future generations to come. Kids Brain Health has seen success with programmes that can be scaled and have the potential to be equally impactful in other areas of science and research. Federal programmes such as the Strategic Science Fund can play a vital role in unlocking and further enabling these kinds of partnerships. We stand ready to help this committee, the government and the scientific community in Canada with inclusive and equitable citizen engagement in research. Thank you very much for your time and I look forward to your questions. Merci.